Morning to everyone. Morning.
Good morning, everyone. Thank you so much for your patience. Before we formally begin our program, we wish to remind our audience of the following house rules for the smooth conduct of this activity. This webinar is being broadcasted live on Facebook. Please keep your microphones on mute for the duration of the call if it is not your turn to speak. For any questions that you would like to ask our panelists, please use the question and answer box. Questions asked in the chat box will not be addressed. For everyone's information, we will have a question and answer portion at the end of the panel discussion. Again, thank you so much for joining us. The COVID outbreak has not only created an unprecedented health crisis that triggered serious economic downturns globally. The Philippines has not been spared, and the effects are felt in all of its regions, including the Bangsamoro Autonomous Region and Muslim Mindanao. BARMM is still a region in transition towards establishing a fully autonomous political entity and completing its normalization processes. Its momentum towards this, including its socioeconomic development, has been greatly affected by the COVID-19 crisis. While COVID-19 cases in the region have been kept low, the response measures taken in the country and in the region to combat the pandemic have triggered major socioeconomic impacts on its population and its economy, even in the short term. Currently, the BARMM government has adopted and pivoted the health crisis by addressing pressing concerns it brought, which made the attainment of the 12-point development agenda more challenging. The BARMM government's response during the COVID-19 crisis focused on improving social welfare and development, essential health services, economic recovery, infrastructure support and governance, as articulated in the Bangsamoro Recovery Plan 2020 to 2022. This report, which we are launching today, which is the assessment of the socioeconomic impacts of COVID-19 in BARMM, consolidated results of 3 research studies aimed to address the socioeconomic impacts of the pandemic, including the economic trends in the short term and medium term. This assessment was commissioned by UNDP in the Philippines in collaboration with the BARMM government and with the support from the Embassy of Japan in the Philippines. Without further ado, I would like to turn over the floor to our first speaker this morning, the resident representative of UNDP in the Philippines, Dr. Selva Ramachandran. Over to you, Dr. Selva.
Thank you, Cha. We have passed the morning. This is good afternoon. So first of all, Excellency Ahot Balawang Ibrahim, Chief Minister of BARMM, Excellency Koshikawa Kashihuko, Ambassador of Japan to the Philippines, Mr. Gustavo Gonzalez, Resident Coordinator with the United Nations in the Philippines, Engineer Mohajirin, Director General of BPDA BARMM, stakeholders from BARMM, government officials, ambassadors, representatives from embassies, international organizations, civil society organizations, academic institutions, the private sector, and UN agencies. Panelists, moderator and reactor of today's discussion, and ladies and gentlemen, I hope I did not miss anyone. Good afternoon, and let me welcome all of you to the launch of the report on the socioeconomic impact of BARMM. The report and this launch are a collaborative work with Bangsamoro Planning and Development Authority, BPDA, with support from the Embassy of Japan and active involvement of the academy who has supported the research work. Once again, I would like to welcome all of you to this launching event. With over 140 million people being affected by COVID-19 across the globe, the virus is everywhere. While many had thought COVID-19 is impacting the most urban areas such as Metro Manila, 1 year down the road, we realized that it has not spared regions far from the center with low caseloads. While the wider effect is broadly understood, it is important to identify and document the disproportionate impact of the pandemic to those who are facing high levels of vulnerabilities. It is within this framework that UNDP, in collaboration with BPDA, conducted a socioeconomic impact assessment of BARMM to generate an insight that could inform the regional recovery planning and, more importantly, much needed action for the population by all stakeholder groups. This report, which we are gathered to launch today, synthesizes the finding from 3 valuable research to come up with fit for context and actionable recommendations. BARMM is among the regions in Philippines that was able to manage and contain the spread of COVID-19 virus. The BARMM government has adapted and pivoted the health crisis by addressing pressing concerns on the ground. I congratulate the BARMM government and the Regional Interagency Task Force for the success in protecting the people from the virus. While these measures deterred the virus from spreading, the indirect impacts associated with the restriction in mobility have affected the lives and livelihoods of many, and most importantly, the most vulnerable groups, which you will hear in a presentation after the keynote message from the Chief Minister. BARMM is still a region in transition towards completing its normalization process. Its momentum towards this, including its socioeconomic development, has been affected by the COVID-19 crisis. Confronting COVID-19 is doubly hard for a region like BARMM, where social and economic conditions are already at low levels. It is important that the region's immediate response and longer-term investments address realities to avoid aggravating existing sources of vulnerability and instead help build resilience, both to the crisis and future shocks. In addition to assessing the impacts of the pandemic, the report identified critical investment areas to build back better and catch up with the rest of the country. Allow me to share 3 of the most important takeaway messages from the report that I trust will bring optimal outcome for BARMM. First, it is important to recognize that mobility restrictions have affected the flow of goods and services, triggered business closure, and ultimately resulted to loss of jobs and livelihoods, leading to significant income declines. This implies more people likely falling into the poverty trap as standards of living get worse in the immediate term, coupled with weak channels of social protection. To address the condition of the people and lay foundation for a solid recovery, strengthening the health sector, including through equitable distribution of COVID-19 vaccine and implementing strong social protection, is extremely important. But strong response alone is not enough, though extremely important. Leading me to my second point, large-scale investment in BARMM is needed. Large-scale investment is needed across different economic sectors to jumpstart a green recovery with more decent jobs and resilient societies as we build back better in BARMM. Business as usual approach with limited increase in investment will only deliver regrowth in the economy with potential implication on increase in poverty and inequality. Therefore, public and private investments focusing on social protection, infrastructure, technology, including digital technologies and human capital, are vital. I would, however, note the significant effort need to be made to enhance absorption capacity in the region. Third, COVID-19 is availing us an opportunity to enhance partnerships. It is important that all stakeholder groups work together with the regional government to achieve optimal outcome. Working across the humanitarian development peace nexus is crucial to help government in BARMM, both as it manages immediate health needs and as the region work to strengthen governance and deal with longer-term impacts of the crisis. As I conclude, allow me to thank once again the BARMM government, specifically the BPDA, for allowing UNDP to play a role in the conduct of the much-needed socioeconomic impact assessment for BARMM. I also would like to sincerely express our thanks to the government of Japan, especially Embassy of Japan in the Philippines, for their generous contribution in support of this assessment and for the wider COVID-19 response and recovery efforts in the Philippines and in BARMM. We are also grateful to JICA for contributing data from its own survey results to this effort. I thank UNDP team who guided the process and the research experts, including Dr. Akram and Dr. Rohelano, for their remarkable effort in helping UNDP conduct this amidst challenging times. I would like to close my remarks by encouraging everyone to participate actively in the discussion, reflect the insights generated from the report, contribute to discussions on how to enhance the implementation of the recovery plan for BARMM. Together, let us build back better and greener for the future of this generation and the ones to come. Let me also take this opportunity to express my warm wishes to those observing the holy month of Ramadan. Ramadan Mubarak, and thank you.
Thank you, Dr. Salva. And as you've mentioned, this assessment would not have been possible without the support of the Embassy of Japan. It is my honor to turn over the floor to His Excellency Ambassador Koshikawa Kazuhiko, Ambassador of Japan to the Philippines. Over to you, Ambassador.
Honorable Chief Minister Ahod Palawan Ibrahim, Chief Minister, Bangsamoro Autonomous Region in Muslim Mindanao, Resident Coordinator, Mr. Gustavo Gonzalez, United Nations in the Philippines, Resident Representative, Dr. Selva Lamachandran, UNDP in the Philippines, distinguished guest participant, and ladies and gentlemen, good afternoon. I'm pleased to join you today for another milestone in our continuing cooperation. In the past few months, it has been my honor to witness Japan deliver its pledge of support to the Bangsamoro through a series of projects. Time and again, our common pursuit in Mindanao peace and development is what continues to bring us today here. Surely there is power in partnership. The pressing concerns in our time have prompted us to heed the call and answer the collective action. And this is very evident in the work Japan does with our development partner like the UNDP. I thank all people behind the UNDP for their utmost dedication to see this joint project through. Our project on the enhancing human security in the Philippines by addressing the socioeconomic impact of COVID-19 would not be possible without UNDP's knowledge and experience on the ground. True enough, we are now gathered here to unveil another essential component of our cooperation. The socioeconomic impact assessment of COVID-19 in BARMM we are launching today will be a big push to its recovery effort. Clearly, there is a need to recalibrate our strategies to rise over above current challenges. The first way to go is carefully identify socioeconomic fallout of COVID-19 and match them with policy recommendations. Recommendations that were evidence-based and pragmatic. I'm particularly pleased with how UNDP arrived at these recommendations with the voice and welfare of the Bangsamoro people in mind. This project shed light on the real plight of the local during this pandemic, which might have otherwise been overlooked by our existing effort. My hope is that this report will serve as a guiding light for the region to navigate through these tough times. Soon we will see unveiled the same Mindanao-wide impact assessment by UNDP and the innovative solutions that chosen civic organizations have come up with. I look forward to more breakthroughs in Japan's cooperation with UNDP in Bangsamoro region. This region remains a bright spot of more growth potentials in the Philippines. Unfazed and undeterred by pandemic setbacks, our friends and partners in Bangsamoro government spare no effort to grow the gains of what we have started. As foremost partner, Japan fully recognizes the value of the work we do. Our staunch commitment thus remains. The more progress we see in the peace process, the more we will intensify our assistance in the region. The Japan Bangsamoro Initiative for Reconstruction and Development, or JBIRD, is a continuing testament to this commitment. Since 2006, projects under JBIRD have catered to the need of Bangsamoro people. We hope to reach out to more locals there, especially in this time of pandemic. The work ahead may seem to be a tall order, but one thing is true, the partnership between Japan and Bangsamoro gives us the assurance that it is when we work together that we are able to make big leaps toward recovery. Thank you very much.
Thank you so much, Ambassador.
Thank you.
We are very honored that you were able to join us this morning. And now to give another message, we are joined by the resident coordinator of the United Nations in the Philippines, Mr. Gustavo Gonzalez. Over to you, Sir Gustavo.
Thank you. Thank you so much. And good afternoon, dear colleagues in Cotabato, in Manila, and from other parts of the Philippines. And Ramadan Karim, His Excellency Chief Minister Murad Ibrahim, Ambassador Koshikawa Kazuhiko, Ambassador of Japan in the Philippines. They are members of the Bangsamoro Transitional Authority, members of the diplomatic community, academia, civil society organizations, the private sector, youth organization, and of course my dear colleagues from the UN, Dr. Selva Ramachandran, and I also see my colleague Oyun Dedemterov, UN colleagues that are facilitating this meeting. Assalamu alaikum, good afternoon. It is, of course, a great pleasure to join this very important event, and I congratulate this growing partnership between the Bangsamoro Transitional Authority, the international community that is today represented by the government of Japan, and UNDP. And of course, first of all, on behalf of the UN team, I would like to congratulate UNDP for the launch of this highly important report, and we look forward to how these report's recommendations could feed into the Bangsamoro region's recovery plan. All of us know that this type of analysis, this comprehensive reading, are extremely important in time of crisis, as they bring the evidence, they bring the facts, data, statistics, measurement of impact that are fundamental for the planning of a recovery phase. As we always say, we cannot transform what we cannot be measured. So this report is a concrete transformative contribution from UNDP. As you know, the Philippines is getting closer to the 1 million cases of COVID-19. And it's fortunate that in BARMM, the numbers of affected people in the region has been relatively low. So the Bangsamoro Transitional Authority has responded quickly, and its initiative have strengthened the region's COVID-19 healthcare and pandemic containment system. But we also need to highlight that this response from the Bangsamoro Transitional Authority is taking place at the same time that they are addressing issues related to peace and security. So, but we also know, and this was reflected by UNDP and Ambassador of Japan, that the impact of COVID-19 resulting from travel restrictions and community quarantines is posing a numbers of challenges to the stability in the region. And I had the opportunity to be 5 days discussing with representatives of the Bangsamoro Transitional Authority and with many other partners, private sector, civil society organizations, UN colleagues in February. At the end of February, I had a chance of being in Cotabato, and I noticed the loss and diminished livelihoods and incomes contributing to increased poverty and hamper access to formal and vocational educational opportunity for children and youth, And of course, the gender impact of COVID-19, including greater vulnerability to gender-based violence. I had the opportunity to meet representative of the Bangsamoro Women's Commission and also the Bangsamoro Commission on Human Rights. And of course, the loss of livelihoods and the increased unpaid care burdens on women. So as you know, the UN country team in the Philippines has just updated its cooperation framework with the Philippines to better take into account, on one side, the impact of the COVID-19 crisis, and on the other side, the new challenges in the Bangsamoro transition. And of course, we made the most of this update to take into account the new features of the UN reform that is calling for a more integrated, consistent, and impactful UN. This investment that was conducted by the UN country team is framed under the title of the Socioeconomic and Peace Building Framework, was finalized last December, and is defining the way that the UN in the country will work, and it also lays down our COVID-19 response and recovery plan. So the UNDP report that we are launching today is offering relevant evidence for the implementation of this socioeconomic and peace building framework in Bangsamoro. Based on the revised cooperation framework, the UN will support the capacities of the Bangsamoro Transitional Authority and local governments unit in reducing poverty and strengthening shock-responsive social protection for the most vulnerable who are not covered by the national safety nets. As you know, the UN has a significant humanitarian development peace-building footprint in the Bangsamoro that takes into account 14 UN entities, 96 programs and projects, and around 200 staff with experts seconded in nearly every ministry in BARMM. So we are well positioned to support the Bangsamoro Transitional Authority and provincial and local governments in addressing the impact of the COVID-19 pandemic in line with the Bangsamoro Development Plan. As we always say, and this was reflected in previous interventions, the COVID-19 crisis is challenging the capacity of any single agency and of any single country. So, and more than ever, it is a time of alliances, coalitions, platforms, and joint efforts. And in BARMM, the UN is committed to pool all our efforts, expertise, and resources. The UN is committed to effectively coordinate, integrate, and align the support of all UN agencies for BARMM's recovery priorities. At the same time, we will work with communities, resource partners, the private sector, and civil society organizations to assist BARMM in addressing challenges throughout COVID-19 crisis. As UN, we are proud of this contribution from UNDP, which will reinforce our reading of challenges and opportunities in BARMM. The goal of putting our collective energy in the service of BARMM should continue to guide us as we support Bangsamoro communities and people in their recovery from COVID-19. Thank you so much.
Thank you so much to our resident coordinator, Mr. Gustavo Gonzalez. And now it is my honor to introduce and to turn over the floor to His Excellency Interim Chief Minister Murad Ibrahim of the Bangsamoro Autonomous Region in Muslim Mindanao for the keynote message.
Thank you. Thank you very much. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. A pleasant good day to everyone. My courtesies to UNDP resident representative Dr. Selva Ramachandran, Ambassador of Japan to the Philippines, His Excellency Kusi Ikawa, Kuzico, of course, our UN Philippine Resident Coordinator, Mr. Gustavo Gonzalez, esteemed members of the panel, guests, friends and partners for peace and development, my fellow Bangsamoro, ladies and gentlemen, again, Assalamu alaikum wa rahmatullahi wa barakatuh to everyone. Let me begin by extending my warmest greetings to our dear Muslim brothers and sisters as we observe the holy month of Ramadan. This is the second time that we will be fasting under a unique circumstances because of the coronavirus pandemic. However, just like the previous challenges that have faced the Bangsamoro, I am optimistic that we will get through this crisis as well, inshallah. In the same manner, the assessment of socioeconomic impact of the COVID-19 in the Bangsamoro is extremely helpful to make sure that we will truly surpass this phase and restore our public health and economy to normalcy. The government of the day in the Bangsamoro is working tirelessly to make sure that no Bangsamoro is left behind. We cannot watch our brethren lose their livelihoods because of the pandemic. We have to act responsibly and quickly because every Bangsamoro deserves the best from us. The launching today is symbolic towards our joint efforts in revitalizing our economy and allow its growth to trickle down to every Bangsamoro household. Our situation in this region is truly unique. Not only were we at the height of rebuilding the bureaucracy when the pandemic hit, but we were still barely healing from the scars of the yesteryears that have gravely affected the lives of our people. But we will continue to work with every resources that we have to bounce back better and provide a better future for the Bangsamoro, inshallah. I thank our dear friends from the United Nations Development Program for leading this assessment and for consistently believing in the Bangsamoro cause. Similarly, I would like to thank our dear colleagues in the Bangsamoro Planning and Development Authority for your help in this endeavor. Let me also extend our gratitude to the continuing assistance we are receiving from the Japanese government since during the peace process and at this point when we are already in the government, in the Bangsamoro government. Similarly to other UN UN agencies who had been with us, the UNDP, UNICEF, all the others who have been with us during those difficult days and until now with these challenges we are facing in the Bangsamoro Autonomous Region in Muslim Mindanao. So To all of you, thank you very much. And to the experts and dear partners who in one way or another vital crafting this document. Thank you so much and good day to everyone. Wassalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much, Chief Minister. And as UNDP, we really are honored to be able to work with the Bangsamoro government in your endeavor to make sure that no Bangsamoro is left behind. Now, without further ado, we will move on to the next part of our program. Here to present the insights and the highlights of the assessment of the socioeconomic impact assessment of COVID-19 in the Bangsamoro Autonomous Region in Muslim Mindanao. We are joined by Ms. Yemi Worki, the Senior Policy Advisor of UNDP in the Philippines.
Thank you very much, Chara. Thank you very much, Char. Can you listen to me? This is Yemsra Kasapa. I'm the Senior Policy Advisor for UNDP. I'm delighted to be here today to share the key findings of the report of Socioeconomic Impact Assessment of the BARMM. We worked with the Bangsamoro Planning Authority. I'm delighted to share the key insights that's coming out of this report. First slide, please, Char.
We disconnected with the PowerPoint.
Okay.
It's coming? Yeah. Sorry, we had a little technical difficulty. I think you can hear me now.
Yeah.
Okay, this is Yemsra Chasafa. I'm the Senior Policy Advisor for UNDP. Delighted to be here today to share the findings of the Socioeconomic Impact Assessment we have undertaken jointly with the Bangsamoro Development Planning Authority. We will be sharing the findings of that report with you today. While we are putting in the presentation by the team, let me try and introduce the outline of this report. What we would like to do today in a very brief way is first and foremost, share with you the objective of the research that we set out to do earlier in March 2020. And then I would then share with you the framework, the policy framework we followed to undertake the study. And then I would share the methodology we followed by BARMM context before the pandemics. And later on, I'll move on to share the key insights that's coming out of the report. And we will conclude with some few critical recommendations that are coming out of the BARMM report. My colleague would be setting out the presentation. We're having a little technical difficulty, but bear with me. As soon as she set it out, we'll carry on from there. But let me continue with the presentation. So by way of the objective, we had discussed with the planning authority, and the critical objective we set at the beginning of this work was first to undertake a rapid assessment of the COVID-19, both in terms of social and economic, the first one, please. Well, before, yes, that one. So, yes, this one. The first one was the rapid assessment of COVID-19, to be followed by an in-depth analysis of COVID-19, and we wanted to identify critical investment scenarios. That's very important for us because we know building back better requires strategic choices, and in doing so, we need to establish what does it take and what are the various investment options that the region has in making a better use of its resources. Then the last one is coming up with the key recommendations policy-wise, and later on we hope that this work would inform the regional planning, programming, and the policy framework as we move forward. Next slide, please. Now, in terms of the framework that we followed, really we have adopted an analytical framework taking into consideration two important factors. One is the transmission mechanism of the impact itself. We looked into both direct and indirect impact, as you could see from the slide. And then beyond the direct impact, which we call the health-related impact by way of morbidity and mortality, we also looked at the indirect impact that would come through displacement of the labor force or the stoppages of work or livelihood and so on and so forth, and government service disruptions, which we took into consideration. And then we also looked into medium, short-term, as well as long-term impact of the pandemics. Next slide. In order to achieve the objective and applying this analytical framework, next slide, Char, we have followed three different phases. The first is to undertake a household survey, where we looked into from March to July, we undertake, and then over 764 households were our respondents, largely low-income households. We also undertook some focus group discussions, key informants, and then social listening interviews we have undertaken. By way of a phase two, through the support of the experts that we have constructed a social accounting matrix SAM for BARMM region, and we developed some few scenarios that we tested to establish the impact of COVID-19. By way of phase three, we looked into establishing what we call a model that looked into computable general equilibrium model, whereby we have tried to project the medium-term impact of COVID-19 using scenarios. Later on, we also thought, since we are UNDP and human development is our critical lens through which we look at anything happening in the development space, we adjusted our normal human development index that we use to COVID-19 impact. And we started measuring the human development index adjusted for COVID in BARMM. In all this, we were guided by UNDP socioeconomic guideline. Next slide, please. I think we have had again a slight difficulty in the slides to be seen. Allow me to reiterate a couple of context issues for BARMM before we undertake this study. The most important, which has already been said at the opening remarks stage, where that Bangsamoro ratified the Bangsamoro Organic Law, BOL, and which allowed the creation of the region, autonomous region. The BTA endeavored to accomplish their mandates by crafting priority codes and laying out the groundwork for sustainable development. The BTA also crafted their 12-point agenda, which has been mentioned earlier on during the opening remark. And in its first year, Bangsamoro government achieved quite a number of milestones, really. The formation of the transitional government itself, the formation of the drafting of the budget for the year, overseeing the initial decommissioning of some fighters, and a crafting of the first Bangsamoro development plan 2020 to 2022. And then as a result, really, as we were set by the pandemic before, we had a very optimistic, positive economic outlook. Next slide, please. Now, in the next slides, I'll try and share. I'll try and share.
The slides.
I'll try to share the impact of the pandemic after COVID-19 hit Bangsamoro and when we conducted the surveys. Allow us, the technical difficulties continue to set us back in terms of showing the slides. We would do our best to catch up as I speak. The main important thing that we would like to share when the COVID-19 hits was that there was a lot of impact. Of course, as mentioned earlier on, the impact in terms of case load has been low. The people affected directly was low, but the indirect impact by way of a containment measure affecting the work, livelihood, and businesses was highest. We have surveyed over 764 households, and 92.8% of them were earning income less than 10,000 pesos, and close to 38.1% of them actually have faced a reduced income, a reduced work situation, or even totally a stoppage of the work. If I may say that the result of that was, of course, a loss of income. 44% of them has faced a decline in incomes. Largely, many of these households were working in agriculture sector, who has faced a decline in income, followed by service sector households who are engaged in service sector. This was one of the main findings. So the income has been, and livelihoods have been affected. Beyond income, we've also looked into other income, non-income related impact of the COVID-19 pandemics. And here we are witnessing close to 50% of the households indicating they had a difficulty in accessing medicine during the COVID-19 pandemic period. And close to 62% also saying that they had difficulty in access to hospitals, largely not necessarily because the hospitals were closed, there was some disruptions, but lack of confidence in going out during the COVID-19 time also has affected many of the respondents from going into the hospitals, accessing critical health services for themselves and for their children. And what was very interesting about this is that quite a number of them also expressed that there was misinformation about the pandemics and the way in which it transmits and how it affects people. So there was a lot of misinformation in terms of communication as well. Next slide, please. Now, we also looked beyond the health sector and ventured into education sector related impact. And what we established is that close to 40% of the respondents indicated that they had at least one member of their household dropping out of school. This is significant because its effect is going to be intergenerational. And the people who are dropping out of school has a potential to be distracted by and then being engaged in negative livelihood options, which may impact the region in multiple ways. The reason for dropping out largely was because of insufficient funds for schooling, and then some of them also fear in acquiring the disease. And some of them also indicated that they had difficulty in accessing internet and they have no gadgets and computers, which are critical when we shifted to a blended education approach. Next slide, please. In terms of access to food, we have, again, very concerning result. 86% of them indicated that they had difficulty in accessing food, largely on account of lack of money and resources, followed by high prices of food and shortage of food. This is critical for BARMM because the larger section of the population has already malnutrition and nutrition-related challenges, both for adults as well as for children. If this continues to be the case, again, it will have intergenerational impact that we need to be mindful. Next slide, please. Now, in terms of support, has population been receiving some support? I have a very good news to say that the BARMM government and its partners have been very well on the ground, providing the necessary support. 93% of the respondents acknowledged receiving some kind of support. It can be cash or in-kind support. And quite a number of them are quite optimistic and acknowledging the positive impression that has left to them in this critical moment. The trust between the citizens and the government has been very much stronger, and they feel very optimistic, actually. 93.7% of them that they believe recovery is possible in the next 2 years. This is quite optimistic and then a very good ground for us to build back better collectively. Next slide, please. I just thought I would share this particular slide with you because the human voices are very critical. And allow me to read the first one. The person who's a wife, a housewife, saying when we interviewed her, the situation is very difficult and painful because of financial difficulties. We cannot afford milk. So we have to mix rice water with sugar to provide to our children. Reading this is the most painful thing to see because it impacts the children who are just the future of the Bangsamoro being impacted as they grow up. And then if you also look into the various other testimonies that has been shared with us, people are expressing how much the difficulties that has been inflicted by pandemic affected their lives and livelihoods, including the access to technology and digitalization, how it impacted their learning, which I think is critical to share with you. Next slide, please. Now, we did not stop by just doing the assessment. We wanted to establish critically what was the impact of COVID-19 in 2020 in the immediate term. And there we are, we have done 2 scenarios. One, if COVID never ever happens. And the second one, when COVID happens. So in the first scenario, if COVID never happens, of course, BARMM would have grown by 8.7% of GDP, and it would have, among the sectors that would have made it grow and prosper would have been agriculture, manufacturing, electricity, transport, trade, and finance. But because the pandemic happens, and it is a reality, the BARMM economy is expected to contract, and our estimation is that it might even contract beyond this. We have been very conservative in our estimations. 3.2% decline in GDP, regional GDP, might be happening in 2020. And the sectors that would be most impacted by the pandemic, agriculture, mining, and then manufacturing, and the trade, of course, would be main sectors that would be seeing some contractions. Next slide, please. By way of looking into the distributional impact, because we believe that the pandemic was not innocent or its impact has been felt across, but some have felt it more than the others. In this regard, when we look at the 2 scenarios, you would see that total consumption, we divided them into 10 deciles, the population, and look the impact. You would see that the first 6 deciles correspond to the poorest population. And the impact is that if no COVID happened, the both income as well as consumption would have grown positively. Whereas because the pandemic has happened, all decile groups have been impacted. And of course, a small decline for the first 6 deciles means a significant impact for them in their lives and livelihoods. Next slide, please. Beyond the immediate impact, we looked into the midterm impact of the pandemic in 2021 and 2022 using scenarios that we built, and 5 scenarios. Bear with me, I'll try and describe each one of them in the assumptions that we used. The first one was business as usual, assuming that nothing changes. And we changed only few exogenous variables therein. One of them being the rest of the world transferring money to the government of Bangsamoro, increasing by 10%, for example. What happens? We assumed that the pandemic would be managed by 2021, population would grow by 2.08%. Here is the first one, business as usual. And you would see that, of course, consumption increases slightly to positive space, investment declines negatively, and you will see both nominal as well as real GDP increasing by around 3.5% therein. This is not ideally the best because it would mean a cut in the targeted GDP growth rate for Bangsamoro by almost half. So it's not really a best outcome that one wanted to have. So let's look at a recovery scenario. What did we assume in a recovery scenario? We assumed there that if recovery happens quickly, for example, and we maintain the population growth as is, increase export prices by 5%, the demand for Bangsamoro export increases, and the rest of the world transfers to households as well as government increase by 10%. This is the outcome. The outcome is such that GDP growth would still be within the range of 3.5, 3.2. Investment continues to be declining. Consumption increases slightly better this time. And wages improve slightly better this time. Again, this is not a perfect case scenario because you would see that growth of the economy is much lower. Next slide, please. We assumed another third case scenario where we build up the case for a higher investment, whereby we assumed government transfer gets boosted, ramped up to by 10%. The rest of the world transfer to households as well as government increases by 10%. This is what happens. There you see a significant increase in GDP, not majorly, around 3.5, 3.4 still, and more consumption happens therein. Investment continues to decline even further, and the share of agriculture continues to rise on the first graph. So we assumed again another scenario because this happens to be still not the best case scenario. We increased the public investment in this case. And then we assumed that we will increase the government capital stock by 10%, where infrastructure investment is ramped up. Quick gestation projects are being brought on board. There we see a major departure, if I may say. GDP growth rate, real GDP growth rate increases to 6%, and from 5.9 to 6%. This is major. Wages increasing again very positively, consumption increasing, still investment continues to be negative. But in general, this particular scenario is a good outcome for all the decile groups. Now, the last scenario where we assumed that productivity would increase, be over and above the government spending increases, the government transfer increases, and all that, all good things happening, what will happen? There we have seen major fundamental increases in real GDP, reaching 7.5%, which is the pre-COVID target level. So if Bangsamoro is going to really bounce back, more needs to be done, obviously, not only in increasing investment in government, but it has to be targeted towards infrastructure or capital stock building, and it should also be increasing and protecting the population, and also increase productivity of all sectors. That is when real-time recovery can happen. So those were the 5 scenarios, and they really point out our investment options. Next slide. Lastly, I would like to share this particular slide with you. Being as UNDP, we calculated the Human Development Index for Bangsamoro, and you would see that it was steadily, if not very fast, it was increasing over time. But because of COVID-19, we are anticipating that we'll be set out to lose close to 9 years of progress that we have made because pandemic affected all 3 aspects of human development: income, education, and health of the population of BARMM. So this is a major setback, and we need to work really hard to reverse the situation. Next slide. So in general, yes, we have had the 12-point agenda. We've been working, and the government of Bangsamoro was pivoting its work to respond to the pandemic, but we faced numerous challenges. Many of them relate to health service delivery, capacity, limitations and lack of resources in multiple sectors to support the economy, for example, supporting medium and small enterprises. There was significant interruption in public service delivery, and we've also faced data gap have been a major gap we witnessed, even to providing social protection support. The fact that there was no community-based monitoring data to monitor data for beneficiaries has been a big challenge. And lastly, the information communication technology, ICT connectivity challenges have been a really major setback in the response period. And we are hopeful that this would be corrected. Last but not least, also the respondents indicated peace has been relatively stable. Sustaining the peace and security is critical, in particular in some areas. Next slide, please. Now, allow me to just finalize all of what we are seeing from all this analysis. Of course, containment measures were critical and important. Nonetheless, they caused some challenge in terms of livelihood and income being lost, which has a major impact beyond income, going all the way to food security, health, and education. The economic activity in BARMM has been is going to contract in the immediate term. And lastly, for us to bounce back better, significant investment capacity need to be put in place to absorb large-scale investment that may come across. Next slide, please. This is my last slide. In conclusion, the BARMM government has adapted and pivoted its work to respond to the health crisis. Nonetheless, more needs to be done in specific areas, for example, strengthening the health service delivery, including distribution of vaccine equitably to all part of the population in BARMM. We need to be ready. We need to be putting in place a system for the distribution of vaccine. Work is underway. It needs to be supported and strengthened. We need to assess the current social protection system of BARMM to see if it is efficient and effective in delivering support to the most vulnerable part of the population. We should also aim at bringing in universalism to the social protection, because that is one of the critical milestones that we put in place in the Agenda 2013. We need to also consider a special stimulus package for businesses, especially the informal sector, to come back better. And then last but not least, we need to look into green recovery approaches as we build back better. And more investment in human capital is very, very critical. And we need to really look into digital tech transformation as an instrument for us to reimagine public service delivery. With these few policy recommendations, I would stop here and thank everyone for your attention. And I also thank all the researchers that has been acknowledged in the opening remark for working with us in the Bangsamoro Development Planning Authority. Thank you very much.
Thank you so much, Yemi. And now we will move forward for the next part of our program. We have invited several panelists from different organizations, from the government, from CSOs, to join us to unpack the insights that Yemi has just discussed. To moderate this panel discussion, we are with Attorney Ishak Mastura, the Chair of the Regional Board of Investments of BARMM. He is with us in person today. Hello, Attorney.
Hello.
Among our panelists, we have Honorable Attorney Liza Alamia, member of the Bangsamoro Transition Authority, Honorable Attorney Raisa Jajuri, Minister of the Ministry of Social Services and Development. To represent UNICEF Philippines, we are with Ms. Oyun Dendevnorov, representative of UN Philippines, and Mr. Andrew Morris, the head of UNICEF Field Office in Cotabato. To represent the youth, we are also joined by MP Marjani Makasalong, chairperson of the Bangsamoro Youth Commission. So without further ado, I'll turn over the floor to Attorney Kokoy for the panel discussion. May I please request all of our panelists to please switch on your cameras and your microphones as well. Thank you so much.
Thank you for. Hello, can you hear me? Yes, I'm Attorney Isaac Mastura, the Chairman of the Regional Bangsamoro Board of Investments. I'm your moderator for this afternoon's program. I'm going to shoot questions to our panel members, and then if we have time, we'll have another round of questions that we have prepared for you. So without much further ado, I'd like to ask our first question because we don't have much time. And this question is addressed to Attorney Liza Alamia, member of the Bangsamoro Transition Authority and Minority Floor Leader. The Bangsamoro region remains to be the region with the least number of COVID-19 cases. However, due to containment measures, the impact of the crisis on the Bangsamoro people became large, and this affected various aspects of their daily life. After more than a year since the first lockdown, in your opinion, having full compliance with health protocols? That's the first question. And follow-up question is, what lessons can be gained from this experience, and how do you think can these lessons be used for future response interventions? Attorney Liza, did you hear that question?
Thank you very much, Attorney Ishak. I heard questions. The questions are complex. So I will try to answer this in as shortly as possible. Now, the first question is premised on the idea that we have to sacrifice the economy for health, or sacrifice health for the economy. Perhaps the best way to answer this question is to reframe our mindset. Instead of treating health and economy as trade-offs, we should treat them as two sides of the same coin. The health and the economy are intimately linked to each other, and often they move in the same direction. So an improvement in health allows people to get on with their lives. It lets us work, run our businesses, and plan out our investments with certainty. It also lets our kids study so they could have a better future. Similarly, an improvement in the economy allows people to afford proper hygiene and better health care. And it enables our families to stay strong and eat 3 square meals a day. So, just to contextualize, I think we should really stop trying to think of health as a necessary trade-off to earn money and vice versa. So a health problem is an economic problem, and an economic problem is a health problem. So while this may seem like we are facing a chicken and egg dilemma, the experience of other countries have shown that it isn't. We need not look far. Let's look at Vietnam, the only country that was able to grow its GDP in 2020 despite the pandemic. And it did so by solving the health problem first. So the government of Vietnam implemented early, aggressive contact tracing, testing, and effective treatment for COVID-19 cases, while its people followed accordingly. So masunurin yung mga tao. The same was true also for New Zealand. The government of New Zealand did not adopt the herd immunity approach. It did not let the virus infect its people and wait until most of them were immune. Instead, what it did was an aggressive test, trace, treat approach. Now we see that they're now getting on with their lives as if there is no pandemic. So what do we need to do in the BARMM? Well, we boost public confidence by showing that the public sacrifices have worth, that we are making progress. So a year on, we have found that the Bangsamoro people are actually eager to obey the laws and regulations related to public health. We see that in the report that has just been made now, in the reports of the Ministry of Health. They are not pasaway, actually. We see our communities doing their best to follow protocols, especially when we see makeshift masks and shields among those who could not even afford them. And they practice social distancing, no? Because they acknowledge the risk that COVID presents. Now, what causes concern and to some extent demoralization is when they are asked to sacrifice over and over again, but with little to show for. And so the report earlier made would show that thousands have gone hungry, livelihoods are disrupted. And so there should be an assurance from the regional government that the situation is improving. They should see that using our regional government's resources, laws, and programs are implemented. How? We hire more health workers. I think we should invest more in the Ministry of Health. We need investments to build and improve health facilities to effectively test and trace the those who are asymptomatic, those who are considered as PUIs, and to procure and equitably distribute COVID vaccines. I think that's the priority now. We win public trust when we show that we have solutions and we demonstrate that the region's leaders, our facilities, our institutions are working for them, and that the public sacrifices will not just lead to more sacrifices in the future. Then also, furthermore, people will become more confident when they don't feel like they are on their own in the fight against COVID. So as we have done before, what we need to do, and this is one of my recommendations, is to provide targeted and direct assistance to indigent households. Based on the report, we have done that. We need to continue doing that. We need to give wage support and subsidies to MSMEs and cash for work schemes for those who are laid off and struggling to find new jobs. So until now, a lot of them still do not have jobs. So health goes hand in hand with the economy. So we need to equip our people with tools to survive. And this dovetails into the peace building and normalization process of our transition. In that through its swift and effective response, the Bangsamoro government should be able to show that ratifying the BOL was the right decision. So what lessons can we actually gain from this? On the other question, I think, let me begin by going over the research findings. So we have observed that in 2021, based also not just on the research, but my own office's projects and consultations, most families and persons suffered hunger and declines in income due to mobility restrictions. And in fact, the impact was harder on those engaged in the informal sector because they lacked access to formal safety nets. Most of them were women, and most of them were heads of single-parent households. Children also reflected poorer learning outcomes and other things. So we have a problem on our healthcare system in the region. This was already patchy pre-pandemic and then now suddenly pushed to the limits. Now, these results find support in my personal observation, perhaps even compounded by the risks faced by internally displaced persons, former combatants, widows and orphans of martyrs, among others. So nonetheless, those data are highly instructive to the decision makers in the Bangsamoro, and because they shine light on the pressing needs that require attention. So I think one very critical lesson is that we suffer from different levels of vulnerability. While based on the research and based on anecdotal data, some are surviving, but we know that there are different levels of vulnerability. We are all facing the same pandemic, but we are facing it differently. So we are not all in the same boat. We are all in the same storm. Some are on super yachts, while some just have just one oar. This was a quote from Damian Barr. And the study's findings now are concrete proof that vulnerability stacks up even exponentially. So my recommendation is that when it comes to complying with mobility restrictions and health protocols, we have to face the realities of poverty and inequality. The other lesson is that intervention should avoid the one-size-fits-all approach. They should be targeted and tailored to actual needs. And the other thing, the other realization as I was listening to the presentation, as a human rights worker and advocate, I think I invite everyone, the government, the Bangsamoro government, UN agencies, and other development partners to begin perceiving aid and social protection from a rights-based perspective. So each person is a human dignity and human rights, and it is our shared responsibility to safeguard such dignity and rights. And so assistance that will be provided in crisis situations should not be dangled as a prize over which to compete but rather thought of as a duty which must be fulfilled. So this targeted rights-based approach then allows the government, the private sector, and civil society to simultaneously acknowledge real needs and to search for the best ways to respond to such. So there are still other recommendations that I would like to make, but I think I'll do that later and give the chance also to the other panelists to speak. Thank you.
Thank you, Attorney Liza. And by the way, Attorney Liza is also a registered nurse. So when she speaks about health matters, she's quite familiar and she's on ground that she knows very well. So let me continue with some of the issues with regard to the report. And let me read that question where it says that there seems to be some hesitancy to support vaccination due to fears and or perceptions surrounding it. What do you think would be effective for the Bangsamoro government to lessen vaccine hesitancy and at the same time strengthen the health system in the region? If you notice, some of our local government officials took the vaccine before there was a rule or guidelines from the national government for them to already take the vaccine. And the reasoning was they needed to provide confidence to the rest of the public. So that indicates to you that at least in the context of the Bangsamoro Autonomous Region, it seems that vaccine hesitancy is a big issue. So go ahead, Attorney Liza.
Thank you, Attorney Ishak. Now, vaccine hesitancy actually in the BARMM is deeply rooted in fear and distrust, not just of the vaccines, but of the entire healthcare system, the government, and even pharmaceutical companies. People don't trust, not the vaccine, people don't trust the healthcare system, the government, and pharmaceutical companies. Even before COVID, we have seen this when there was rampant disinformation with respect to vaccines for measles and polio. And this caused the resurgence of these diseases that were already previously eradicated. Now, with respect to the COVID vaccines, based on our consultations and anecdotal data, communities have been largely ambivalent. Why? Because of their distrust from one vaccine brand to another brand. And then there's also the fear of possible side effects, even death caused by getting the job. So what do we need to do? I think we need to have an active health information campaign on the COVID vaccines. And again, I would like to belabor this point. We need to improve our health system and increase our investments on healthcare. And that would mean improving our hospitals, improving the services that are being provided by the Ministry of Health. So it's investments towards health. Now, the campaign on this health information could cover what a vaccine is, how it works, what are the possible temporary side effects, and then it should be contextualized to the communities in the BARMM. It should, the campaign project should focus on the protection of the self, the family, and the community. And there should be a strong showing of data or statistics which illustrate the benefits of immunization. It should also promote listening to data and medical advice instead of gossip and mere anecdotes. I think that should be part of the messaging that should be made by the BARMM when it comes to the vaccine, alongside with immunization caravans for COVID vaccine rollout. Now, it should also, on a more practical sense, and to strengthen our health system in the region, we have to make sure that vaccination will be a pleasant patient experience. So as Attorney Ishak has said, I'm also a nurse. I think this is where most of the hard work that needs to be done. It should not be difficult for a patient to sign up, line up, and get vaccinated. Now, this requires a lot of hard and soft infrastructure and groundwork. Like, for example, we need to establish vaccination hubs, Second, we need to procure cold storage and transportation equipment. And most importantly, I think that this is the elephant in the room. We need to purchase the vaccines. We have a budget for that. In fact, in the current ARM budget, aside from the budget for the purchase of vaccines, we could also revisit with a more discerning eye the BARMM budget for 2021 for the purpose of finding some fiscal space for health, vaccination, and aid programs. Thank you, Shaq.
Thank you, Attorney Liza. Now let me go to the meat of the report, which is the socioeconomic impact of the COVID. According to the BARMM SEIA, that's this report, the economic growth in the region can be spurred given a robust and comprehensive approach to development. The report provided several scenarios for building back better. Mindful that BARMM is at the middle of a transition or in a post-conflict scenario, how do you see the BARMM government approach the recovery phase, considering that large public and private investments are needed?
Thank you. That's a very important question, and I have to be very candid about this. When we examine the Bangsamoro Appropriations Act, it's really hard to tell if the BAA in itself, in totality, is a budget that is designed to overcome the effects of the virus. Well, there are portions there that talk about, for example, the allocation of budget for the procurement of vaccines. The entire budget really, we're not very sure that it can overcome the effects of the virus. So based on the 5 scenarios that were presented in the study, there's currently a big risk of sticking to business as usual, because that's likely where we are headed. Now, the computable general equilibrium model tells us that the business as usual scenario is notably the worst outcome because it would lead to anemic growth and sluggish improvement in human development. And I think we can all agree that we don't want BARMM to be stuck in a vicious cycle of rising COVID cases, spontaneous lockdowns, and therefore we need to change our strategy in order to avoid that future. And again, the healthcare capacity of the region needs to be prioritized by the government. I have raised this also in the plenary session of the Parliament of the Bangsamoro Transition Authority. This means funneling more funding towards the operation of more health facilities, particularly Tier 2 hospitals that are capable of intensive and specialized care. Now, conceptually, this might steer us in the direction of the increase in public investment scenario. Some of the quick gestating projects like, for example, farm-to-market roads and community water supply could be interspersed with much-needed improvements to hospitals and health facilities. In fact, it is possible to do this even without a law through budget augmentation. We look at unobligated balances in some items in the Bangsamoro Appropriations Act, which can be declared as savings. For example, infrastructure projects that are not urgent, and some other items that are unlikely to be implemented for the year. Then we use those savings to augment hospital operations, upgrade their equipment and facilities, or to hire more healthcare workers. Well, the other way is for us to enact a special appropriations law to create new programs and activities. But right now in the plenary, in the parliament, there are several initiatives pending for specific provinces. Perhaps we could consolidate this and study this with technical assistance. So now some of this budget, we can use that, the fiscal space for that. We can use that by rationalizing the non-priority items. So we hand in hand, we make health work hand in hand with the economy and the people's welfare. So we channel those unobligated amounts or savings towards direct cash assistance. I think this should continue in the BARMM. Direct cash assistance to only targeted vulnerable groups, Also, direct cash assistance through wage support and subsidies for MSMEs, as well as job generating schemes like, for example, cash for work program. So there should be a regional stimulus packages, and I hope the MTIT and the other ministries are listening. No, there should be a regional stimulus package, like this saves people and businesses in jeopardy by putting money in their hands. If you put money in their hands, then this revitalizes the local economy more quickly and sets into motion more immediate multiplier effects. And we do all of this health, economy, hand in hand with the peace building and transitional justice work in view of the pandemic. We focus on those who have been marginalized, excluded, or victimized by, all of the human rights violations before, and they should not suffer now. So it is part of dealing with the past, aside from material and symbolic reparation. Thank you, Ishak.
But I'm glad that you brought the issue about cash transfers, because if you notice, the report also talks about a universal basic income as a model for the BARMM to follow. So hopefully on the economic side, that's something that the UNDP can push, the universal basic income, pilot it here in the BARMM, because we're the poorest region and we have the most number of poor people. So that's something that we can look forward to. So thank you, Attorney Liza. We'll go on to other members of the panel. Next up is Ms. Oyun Dendev-Norov, representative of the UNICEF Philippines, together with Mr. Andrew Morris, head of UNICEF Cotabato Field Office. Let me shoot the question to Ms. Oyun. Given the highlights on human development outcomes among children described in the report, what do you think shall be the future of children's development in the region? Go ahead.
Good afternoon, colleagues. Thank you very much inviting UNICEF to participate in this panel discussion. It's great pleasure to share our views. I want to just go back to what was presented by our UNDP colleagues, maybe straight to recommendations and conclusions. That's specifically strengthening health services and improving the vaccination program, social protection system in BARMM. So what I really wanted to highlight that these are very critical areas, but before I respond, I also wanted to link my response with what MP Liza mentioned with regard to vaccine hesitancy and how do we improve. So these are very critical areas. And then before even COVID pandemic, children in BARMM, they have been affected, and the children, almost so many children have been really suffering from many services that were not of good quality. But I would like to mention that is indicated also in the report, the situation of children in BARMM, it is really one of the worst in any region in the country, and pandemic has really brought even further worsening of the situation. So this crisis can really affect 2 million children in BARMM and can put children at risk. But I may suggest going back to what I mentioned, like just taking example of vaccine hesitancy. There have been quite many work even before pandemic going on, and so we know that vaccine hesitancy is very much prevalent, but in BARMM, I must say that UNICEF is closely working with the Ministry of Health, and BARMM has been, in terms of response to polio measles outbreak, have been one of the best in the country. Because really families, communities responded very strongly, and then the coverage of the vaccination even was higher than 90%. So we should be building on what is the achievement before to take forward some of the concerns that was highlighted earlier. So I can attend some of the questions, but I want to say that really situation is presenting or putting the children in most difficult, challenging environment.
Thank you. Let me just shoot you a follow-up question. What factors should the government take into account in addressing possible challenges encountered in addressing children's needs?
Thank you for the question. I would like to mention that before last week, actually, with Chief Minister Ibrahim and resident coordinator and also Ministry of Social Protection in BARMM, Ministry of Social Services and Development in BARMM, we had a really very good discussion about the situation of children in BARMM. So yes, I see that the report really talks about 65% of BARMM children live in poor households. This number is increasing, and then according to also UNICEF projection that children, about 90% of the children may live in poverty in BARMM because of the evolving situation. So my suggestion would be poverty is really one of the underlying factors that's holding back the rights of the children realized in BARMM. And so we need really to look into this aspect very closely. And my also recommendation from UNICEF side would be really to improve health facilities and the services, education services, and we need to really to look into some of the costs of the cost of seeking care, excuse me, seeking care and then attending schools. These are very important questions that we need to respond, and also families, both parents also need to work and leaving not too much time for really childcare. And pandemic is very much really forcing many families to struggle to really meet the ends and really to find a way to meet the basic expenditures, etc. So I would like to really suggest that we need to look into these issues holistically, and we need to really put our hands together. And I'm very happy that the ambassador is participating, Kazuhiko is participating, and we as UNICEF are collaborating in the area of education, providing support to children who are really lagging behind or out of school and who really need education services. So we need to look into these matters very much in a holistic way.
Thank you, Ms. Oyun. Let me go to Mr. Andrew Morris because he is the one here at the Cotabato City local office. And I think he would be the one that can answer this question that was also brought out by Ms. Uyun. And this is with regard to the education and the care economy. So the question is, how may we bring the care economy to light and surface this in discussions as women are largely engaged in the unpaid work largely related to caring for children? So as you are aware, Mr. Morris, most of the children now are at home. They're not allowed to go to public schools. So the children are with their parents, in particular the women, because they're the ones taking care of the household. So they cannot go outside also to do work because they have to take care of the children at home. Before, when we had a regular economy, the children were at school and the women could go out and seek work together with the husbands. So with the education needs of the children now suffering as well, and they're at home, where the mother is also with the family, how do you think we can help the economy in this kind of situation? What are the strategies that we can do to meet this complex situation? Mr. Andrew Morris, please.
Yes, thank you very much. Yeah, could I just add a couple of comments first? As we've heard from previous speakers, poverty is already very high and increasing, and poverty is a foundational factor in terms of the realization of children's rights. So if that's not addressed, then we are on very, very weak ground. Whether it's increasing malnutrition, whether it's dropouts from school, unless that is addressed. And I think in terms of the whole crisis, I agree with earlier speakers that much higher investments are going to be needed for children to address the COVID-19 recovery. The recovery plan really has to put children at its core. And if that's not done, then really BARMM is risking the loss of a complete generation of children that were born last year and for the next decade will suffer. That means more investment in health systems, community nutrition, information for families on parenting, and importantly, the social protection systems, whether that's cash or other, but a large role for cash to protect the poorest households so that they can be assured of the minimum resources to take care of their children. Those are some of the things that the government needs to consider. The interim government is very, very busy restructuring, looking at new programs for development of the region. But maybe this is also an opportunity because of the adjustments in programming budgets. So an opportunity to really make adjustments, and I'm sure they will. In education, I think the education sector and the impact of education for children, the impact of the pandemic on education for children is probably one of the biggest, most immediate, visible, wide-ranging negative impacts for a lot of children. Some of the other impacts are less visible, maybe silent emergencies, but I think the impact of the pandemic on education is absolutely an emergency. For BARMM's 1.4 million school-aged children. And let's remember that even before the pandemic, 40% of children were not enrolled in school. That was over 500,000 children not in school. Many of those were adolescents, mostly boys. So major issues there. And the pandemic has brought a complete halt to learning. Since March last year, now 1 year, classes have stopped, face-to-face has stopped, even for the children who were enrolled before. And unfortunately, the digital divide, which I think another panelist may address later on, the digital divide means that children in BARMM don't have access to internet connections or gadgets, laptops. So online learning is really for the elite of BARMM's population. The home community and at-home learning, which has been the main modality, yes, in many areas is expanding, but it's very difficult because both parents in BARMM in the Bangsamoro region are often working because of poverty. So if both parents are working, there is little parental supervision or guidance for education. It's very difficult. On the care, well, in fact, in our experience, both parents need to work. So mothers and fathers are out of the home earning an income. Yes, during complete lockdowns, they were confined to the home, but across BARMM now, this is not really the situation. And as the lockdowns have been eased and people can move, they're increasingly returning to their agriculture and their other means of earning an income. The way forward is not really related to the pandemic. It's a fundamental issue of how to make sure that children at the youngest age are cared for, have the support, not only for their safety, but for play, stimulation, preparation for nursery, getting into kindergarten and the formal public school. That's really the issue. There's no easy answer to that, but it's going to be a combination of the social protection to make sure that no family is without the basic resources. It's going to be a combination of that with information on parenting so that parents understand the importance of spending time with children at that youngest age, and early learning classes, community preschools, more widely available at free of charge. That's really going to be necessary and part of the package. But we all know that education is the future. We talk about it. We know that education has given us, many people on in this forum, tremendous benefits in life. We also know that missing out on 1 year or 2 years of education, and quite frankly, that's what we're seeing in this region. It's 1 year of education lost for many children. It might well be a second year. So really it's a crisis, and the report was very, very good in highlighting the impact of the pandemic on the region's human capital. That starts with investing in children. So we would say immediately try to get schools reopened in the areas where there is very little COVID risk. And there are many areas in the Bangsamoro where
I agree on that.
There are no COVID cases. There have been none. With the appropriate monitoring, LGUs taking a lead with the appropriate monitoring. So we're not advocating that children are put at risk. And then, of course, in making the budgets, the funds available for that safe return to school, not just a return to school, but a safe return on a reduced face-to-face basis, but that will help kickstart the education learning again. Then the funding for the catch-up classes, the alternative learning system has a lot of difficulties in BARMM. There needs to be investment in that, the catch-up and investment for teachers to be able to cope with that. That might need special budgets now or realignment, and definitely needs to be fully into the 2021-22 BARMM budgets. And we think that investing in education is going to be one of the single most important things that can be done in this period to recover better. And I think that's what it's all about. So thank you very much.
Miss Uyon, then Norov, and Mr. Andrew Morris. We'll go on to the next panelist. But before that, I'd just like to congratulate Mr. Morris for pushing for the early opening face-to-face classes in least affected areas of the COVID. I think this has been a call a long time ago by a lot of observers, even experts, because we're the only country that hasn't opened its schools to face-to-face, even in areas where there's less COVID. And the perfect example is the BARMM. And if we're an autonomous region, maybe we should start really thinking, and our policymakers, our leaders, the chief minister is here, is listening in. We have to make a study or a case for opening classes face-to-face in the BARMM, so that we can address the emergencies that that was mentioned by Mr. Andrew Morris. So with that, we go to the next panelist, MP Marjani Makasalong, Chairperson of the Bangsamoro Youth Commission. The question, Mr. MP, is around 40% of households had members who dropped out of school in the BARMM. Given the regional context, young persons who drop out from school have very limited options to be a productive person. Considering real economic needs of the youth and possible sources of distractions or influence, that is from barkada, social media, to something as serious as criminality or drug trade, what do you think will be effective ways in providing support for the young persons to ensure that they have access to education, viable livelihood options, or safe spaces to live in to have a brighter future?
Thank you very much. I think let me begin by saying that this figure really captures what's in the ground, and also would like to reiterate before giving my own idea on the question that this kind of question is, as they have already said, that it is very complex. There is no very straightforward answer on this, and I think we can use our creative way on addressing some issues. In our case, the out-of-school youth is an emerging main problem among the young generation. I think the Bangsamoro government in general, and also the Bangsamoro Youth Commission in specific, have been thinking of possible ways on addressing this kind of issues. And let me begin by saying that as early as last year, when the lockdown started, we have already anticipated that our sector, or the youth, especially in terms of education, would be among the most affected sector in area, because of course the schools, for example, would be closed, and then naturally the out of school youth would become more. So I think in answering the question, one way of addressing this problem is in bigger picture, to engage the young generation. That is a very general statement, but I think one of the main issues that they always emphasize, or their concern, is that they're always left out, and it does not match the saying that they are the hope of the future, because they are not really well engaged in many aspects. So in our office, and our effort is that we have few programs that would directly address their concern. Number one, we have this Lingkod Kabataang Bangsamoro. We are now in our wave 3. That is our humanitarian initiative to address, or to go for the most vulnerable youth sector, to help them, because we know that they do not have, or they have to stay at home, and they cannot go for to find their own living. So we know that it's not really 100% enough, but at least we have a way of addressing their concern. Number two is that this is in partnership with the Ministry of Social Services and Development. Ma'am Raisa is there, that they have the Alay Kabuhayan program that gives 15,000 as a startup livelihood for the out of school youth, and we have already started in some areas. I think last month or a few weeks, we have started here in Cotabato City to give that 15,000 to the out of school youth, and they, as they said, they are going to use this for maybe a kind of sari-sari store, or any kind of small businesses, in order to support their daily living. So that is very important, because as I've said earlier, that they also want to feel the direct intervention of the government for them. It's not only, for example, in the area of health, in the area of education, but also those who are out of school youth, they also want to feel that the government, or they are part of the society in which the government is giving services. And to be very specific in terms of education, our out-of-school youth, we have been working with the Ministry of Basic Higher Education, Technical and Basic Technical and Higher Education, especially with the technical education for our out-of-school youth to provide trainings in order for them to equip them to face the new challenges. So, for example, the kind of bakery, for example, or the cell phone repair. They are very basic, but they really need that in order for them to even a small amount they earn daily. So we've been in touch with the MBHT, especially with the TESDA, in order to give more trainings for more out of school youth. But to the question of livelihood, and we have already mentioned that it is one of the main challenges in our area that we do not have a strong internet connection, especially, for example, in the island provinces or even in Lanao del Sur, for example, and Marawi City. Sometimes you have an internet connection, sometimes you do not have that strong internet connection for us to have our for us to have our businesses there. So despite of the idea that online businesses would become lucrative in this time of pandemic, that is still a hindrance for us because we cannot, you barely can open your Facebook in some areas. How much more if you are going to deal with how much more in dealing businesses. So I think what we can recommend here is that I know it's not an overnight issue, but this has been raised again and again that if we can have this strong internet connection, then probably it could help a lot to our constituents, especially the youth, because we always say that they are internet savvy and they know how to deal with this. But unfortunately, they cannot maximize it because of the very slow internet connection. And lastly, for the overall productivity of our youth, especially in this time of pandemic, I think we have strengthened our connections with the youth organizations on the ground. Because and this has been our strategy ever since that we took over the office on the Bangsamoro Youth Office Affairs before even became a BOYC or Bangsamoro Youth Commission, that we try to engage more youth organizations in the field or in their own community for some reasons, and most importantly is that number one, of course, they know their local issues there. And number two, which is another very important, is they know how to deal with it. So we have programs here, for example, in the region, and we implement it through partnership with the local organizations. And we have just, I think 2 weeks ago, we have already accredited more than 400 local youth organizations in different areas. That includes in Sulu, Basilan, Tawi-Tawi, and of course here in Maguindanao, Cotabato City, and even in the 63 barangays in North Cotabato, and of course in Lanao del Sur and Marawi City. And they are helping us in delivering the basic services to our people. That is two-pronged approach. Number one is they are well, or in the first point that I made, that is for them to feel that they are part of the community or the society or in nation building at large, because they are top in implementing programs. So it's not just that they are beneficiaries of the programs of the government, but they are also part of implementing it. So they, the feeling of the sense and the feeling of ownership that they are actually giving and implementing programs coming from the government to their own constituents, that tells a lot. Number two is that they are actually because they are implementing, they are our partners. They can also easily identify the most vulnerable youth sector in our community. So that goes, for example, in our Lingkod Kabataang Bangsamoro and the Alay Kabuhayan program, we can easily identify the most vulnerable youth sector in the community with the help of these youth organizations, youth accredited organizations. So, in nutshell, they become partner of the government in delivering basic services, and also in the issue of the peace process. Also, in specific, it can also boost their confidence, or they can also go, or they can also play a very good example that the youth or the young generations are not left out by the government. Because if you are going to look at the usual lines of the other organizations that recruit them, the usual one is that they are telling the young generations that they are not actually part of the nation building. So if we can actually engage them, we can rebut it, and we can prove that they are not just a beneficiary of our services, but actually a reliable partner in delivering the basic services to our constituents. Thank you, Attorney Shah.
Thank you, MP. We will go first back to. Thank you, MP Makasalong. We will, and Chairman of the Youth Commission. We'll go back first to our host again because I think she has some words to say to us. Go ahead.
Thank you so much, Attorney Kokoy. I know that we've been having a really, really insightful discussion with our panelists. And at this point, we're only halfway through the panel discussion. And I know it's already 3 p.m., but just to let everyone know that we will be extending the program up until 3:30 to make sure that we accommodate all of the stakeholders and the speakers whom we have invited today. But unfortunately, some of our other speakers will have to leave at 3 p.m. Among these speakers is Engineer Mohajirin Ali, the Director General of the Bangsamoro Planning and Development Authority. So unfortunately, we will have to cut short our panel discussion for now to make way for the remarks that he has prepared for us this afternoon. So I'm turning over the floor to you, DG Haj, for your message.
Yes, ma'am. Thank you very much. This is supposed to be the closing remarks when I saw the program, but again, because of the time that we do have this afternoon, and I have another webinar meeting also this afternoon with the EU and the national government. So I'm very thankful to the UNDP to give me the chance to say something regarding the SEIA, the conducted socioeconomic impact assessment by the UNDP. In fact, when we uh, implement this, there was an initial discussion by me and Brother Chitan and even Butch on how we'll be able to do the assessment. And I'm very happy now that the result, uh, uh, we have the result right now. But again, to give my piece on this the afternoon, I prepare a written speech for this afternoon's event. Bismillahirrahmanirrahim. Rabbi Sakhi Sadri wa Rasili Amri wa Khlul Ugnatan min Lisani Qawli. My courtesies to our beloved Chief Minister Ahud Balawag Ibrahim, sir, to His Excellency the Ambassador of Japan, Koshikawa Kazuhiko, sir, to His Excellency also, I saw him here, the Malaysian Ambassador, Norman Muhammad, to Mr. Gustavo Gonzalez, our resident coordinator of United Nations in the Philippines, to Dr. Salva Ramachandran, resident representative of the United Nations Development Program, to the members of the Diplomatic Corps, development partners and stakeholders, my Bangsamoro, co-Bangsamoro government officials, our members of the parliament who are present here today, colleagues who are with us today, ladies and gentlemen, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Our deepest gratitude to the UNDP, the Minister of Foreign Affairs of Japan, and the Embassy of Japan in the Philippines, together with our partners in supporting the socioeconomic impact assessment of COVID-19 in the Bangsamoro region. This has been a valuable work that can give us a clearer view of what has been happened to the Bangsamoro people during the early stages of the crisis and its impact to the Bangsamoro economy. It has also given insights and hope that instituting collaborative effort and a comprehensive and inclusive approach to recovery and development, much can be done to spur our needed economic growth in the region. However, given the challenges brought by the COVID-19 crisis, we are faced with many limitations. The state of human development in the region have regressed as we try to fight COVID-19 with our limited capacity. Despite the strategies and effort of the Bangsamoro government, we are still having a difficulty in coping with the crisis due to the some controllable factors like the limited resources, restrictions on movement, travel and economic activities, access and distribution of vaccines, or among others. Yet, we know that the Bangsamoro government is not alone in this fight. Thus, we appreciate the presence of our partners and stakeholders today who have remained committed in treading with us through the crisis. Your commitment is much valued. Through this assessment, we have known that the Bangsamoro people have been greatly affected. The informal sectors, the most vulnerable groups, including women and children, have been most affected. Women have reported to have experienced difficulty in coping due to lack of resources, increased care responsibilities, or experiences of violence. Children also had to drop out from school, with many experiencing the brunt of a digital divide. Hospitals and medicines, as well as food, have become difficult to access. These stories can go on. Thus, we need to be mindful that as we recover, addressing these needs have to be in our agenda. Given the challenges of this outbreak, strengthening the Bangsamoro region's capacity is crucial. Hence, the Bangsamoro government created a technical working group chaired by the Bangsamoro Planning and Development Authority (BPDA) and vice-chaired by the Ministry of Health, tasked to formulate the response and recovery plan (BRRP) on COVID-19 pandemic 2020-2022. The said plan shall serve as a roadmap on how the Bangsamoro government shall mitigate the effects of the COVID-19 pandemic, facilitate adaptation to the new normal, and support gradual economic recovery while managing the potential risk of wider infection in the Bangsamoro region. BARMM is a young government in the middle of a transition and much can still be done. The region is in silent need of digitalization. As the report also suggests, public investment have to be ramped up together with giving cash assistance until the economy recovers fully. The means sustain social protection to the most vulnerable and indicated in the discussion guided with the principle of leave no one behind and universalism from the 2030 agenda. Recovery too must happen with an improvement in technology. These are not easy. Thus, I call on partners and stakeholders for collaboration. Let us work on this together. As we move forward, I can call for us to heed on and complement the Bangsamoro government's effort Our coordination and alignment of resources with our new and emerging priorities is important. First, we must prioritize the strengthening of our health system together with the effective implementation of the vaccination program. Second, social protection systems need to be stressed and improved. Third, business, especially the small ones, need to be supported together with supporting greener solutions. And ultimately, through participatory and data-driven decision-making, we aim to reimagine and strengthen public service delivery. For this, we are grateful for the support of our partners for helping us have gains in this area, including having UNDP's Advanced Data Analytics Lab in the BARMM called Kedu Lab. I hope you have gained much insight from this event. May the lessons that we have learned today compel us to work together sacrificially but towards greater gains for the Bangsamoro people. Again, magandang hapon po. Good afternoon to everyone. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, DG Hatch. We truly are grateful to BPDA for letting us play a role in the conduct of the much needed socioeconomic impact assessment for BARMM. And thank you for joining us as well. Now I think we can move forward with the second half of the panel discussion. So I will again turn over the floor to Attorney Kokoy for the continuation of our panel discussion. Just a note that we will have a question and answer portion after our reactors are done with their messages. So over to you, Attorney Kokoy.
Thank you. Panelist, that's Attorney Raisa Jajuri. We're grateful for her for waiting because it's always hard to be the last panelist and you're waiting for your turn. So thank you for the patience, Attorney Raisa. But there is an important follow-up question to MP Makasalong. 70% of the Philippine economy is composed of consumption. GDP-wise, it's consumption. In the BARMM, it's reversed. Around 60% is based on agriculture. So the 70% consumption means it's concerned with services. And during the pandemic, the services economy was the one that was severely affected. Restaurants were closed, malls were not operating. All these things went down, and that's why we moved towards the economy that is based on delivery and the internet. We don't have that here in the BARMM. As I said, it's the reverse in the BARMM. 60% is in agriculture, although there was that data in 2019 saying that the service economy is catching up. But I think when you look at it deeper, it's still basically agriculture based. So my question would be for the youth, how do we encourage them to go back to the land and make our lands productive? Most of our people are farmers, but when they finish schooling, they go out and get employed in the BARMM government or in the local governments. But we don't have industries that employ them as employees. Like we don't have manufacturing base. We don't have big enterprises that can employ them. So they'll have to go back to the land to make the farming into a real profession. So what is your suggestion with regard to that?
Thank you very much. I think another very, very important question. And just to note that we have been also in touch with the MAFAR, Ministry of Agricultural, Fisheries and Agrarian Reform, for us to formulate our works that so that we can formulate our programs that we can work together. And to begin, we have already seen the idea of backyard gardening to encourage the people in general, but also the young generation to do it at their home because they become also jobless, or the out of school youth are just staying at home. So if we can actually encourage them to do that, then we can it would boost the agriculture related products. And to encourage them, I think, as was already mentioned, we can only think of the cash for work scheme that can also be related here. We can, if we can identify the numbers of our out of school youth, if we want to target them, then we can use that cash for work scheme. Then I think we can encourage them. And now we can, although a little, but we can see the improvement in some areas that that the young generation are going back home and they are doing the gardening, planting, tree planting, or whatever that are related to the land, because they have realized maybe that time comes that even if you have money, for example, but much more if you do not have money, that you will not be able to go to the, for example, to the market because of the restrictions, the lockdowns, and so on and so forth. That then we have already seen the improvement, albeit very low, that they have already like they have, at least they have begun to realize that this is very, very important in their own survival, and much so if we need to address the food security.
Thank you. So with that, we go to our next panelist, the Honorable Attorney Raisa Jajuri, Minister for the Ministry of Social Services and Development. Let me ask the question to Attorney Raisa. Cash or in-kind transfers have played a major role in protecting the most vulnerable in BARMM, nationwide in the Philippines and across the world. How would you assess the efficiency of the current social protection system in BARMM? And there's also a follow-up question here on how might we enhance its efficiency considering the recurring shocks and high level of vulnerability in the region? How could BARMM move towards the principle of universalism considering the need to build a culture of self-reliance and productive citizenry? What measures could be taken to ensure sustainable program on social protection? So you can answer it all at once or you can disaggregate it, Attorney Raisa, but I think the questions are interrelated. So you can address it as you wish. Attorney Raisa, go ahead.
Yes. Thank you, Attorney Ishak, and good afternoon to everyone. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Let me first say that there may be other ministries in the Bangsamoro government that may have social protection programs and cash transfer programs. But I will speak specifically for the Ministry of Social Services and Development. Here in the ministry, we regularly provide cash transfers, particularly the conditional cash transfer program of DSWD, the Pantawid Pamilyang Pilipino program, or 4Ps, and other nationally funded programs. We also have other programs under the Black Grant. These regular programs are may also include, or the modality would be the transfer of cash or in-kind. And the beneficiaries, particularly for the cash assistance, would be the orphans who get monthly stipends, as well as differently abled persons. We also provide cash assistance to provide educational support to elementary, high school, and college students. At the height of the pandemic last year and during the community quarantines, we administered the provision of the emergency cash subsidy under the Social Amelioration Program of DSWD. We also provided massive distribution of rice and other food packs for poor households in the Bangsamoro region, as well as communities outside of the BARMM. But in mid-2020 also, we decided to rechannel some of our resources towards the provision of livelihood assistance in the form of cash for seed capital or for augmentation of capital for micro entrepreneurs who were affected by the lockdowns and the quarantines, whose businesses may have failed, or who may want to start new ones after losing their jobs or have otherwise found their incomes reduced. I think that with the presence of the Ministry of Social Services and Development down to the municipal level, we are able to have gather information regarding the situation of our constituents. Therefore, our municipal social welfare officers are tasked to identify the beneficiaries and to implement the cash or in-kind transfers for most of our programs. We're able to do this in coordination with local government units, including barangay officials. However, we do need to devise a mechanism that will ensure the integrity of the list of beneficiaries, as we sometimes struggle with intrusion of political influence or sometimes even fraud, while we deliver our social protection programs. We have installed the biometric registration and identification of beneficiaries in most of our programs, but the system is not able to check names across the whole region and still has many areas for improvement. And more basic than this, we do not have the complete complement of computers, biometric scanners, cameras, and human resources. Although fortunately, we are supported by some of our development and humanitarian partners that have provided some of these necessary hardware. But in the distribution of the emergency cash subsidy under the Social Amelioration Program, for example, we used a digital platform, and this is the World Food Program's system called SCOPE for beneficiary registration and identification. In short, while the ministry is starting to work on a more efficient system for delivery of social protection programs, including cash transfers, we seriously need to improve in many areas that affect our efficiency. And these include, number one, putting an infrastructure that would allow for better beneficiary identification, registration, and validation, and this will necessitate digitalizing our systems. This year, we are about to embark on a pilot project on poverty registry for the BARMM, and we will start with the province of Maguindanao. Since the National Poverty Registry, the Listahanan, is not devolved, it is still with the DSWD, and it is still DSWD that implements this, and they also manage and own the data that is generated from the survey. But we also use a system for beneficiary identification, registration, and validation, like the scope, for example, for a particular program like the emergency subsidy distribution. This platform that we were allowed to use does not belong to us, but to the WFP. Hence, I am emphasizing that we should have our own system, our own poverty registry system, and our own database or data management system. Even the data beneficiary system that we have under 4Ps, in fact, is not flexible enough to cover other poor households that are not beneficiaries under the program, but who may be our projected beneficiaries in our other programs. So how do we enhance this efficiency so that we are able to provide better services, particularly in cash transfers? As I mentioned, we should invest in a poverty registry. The pilot run in Maguindanao will hopefully propel the process for a region-wide registry. And this registry can also incorporate data or information on vulnerabilities. It should also identify households located in disaster-prone areas so that the Bangsamoro government can also easily identify those that may need additional protection when disaster or calamity strikes. Second, we need a digital system that can store the information on the beneficiaries and other data that we're able to get from the survey under the poverty registry, and which can be used for all the social protection programs that we are implementing or will be implementing in the future. The hardware that will be necessary for us to operationalize these plans for poverty registry and a digital database system will have to be procured, no? And the Bangsamoro government would have to invest some money on this so that we are able to work in using computers, tablets, and so forth. I also want to mention that I think our work will be tremendously assisted if there is a national ID system, and this will ensure the integrity of our beneficiary list. As to the matter of universalism, no, the report talks about a universal basic income. That is one of the recommendations. I think the BARMM can consider this because, as pointed out in the report, it is something that would have significant potential to protect household income and consumption, which are necessary for recovery not only of the households, the specific households, but also of the whole Bangsamoro region. Considering the high level of the poverty in the region, it would lessen efforts on beneficiary identification and eligibility determination, which will be much easier where inclusion and exclusion errors will not be a problem. So, but at the same time, we also want to foster a culture of self-reliance among our beneficiaries, while we consider universalism as a principle, as an ideal that could be a choice for the Bangsamoro government. We should also look at how we can best implement universal programs with the objectives of helping our vulnerable sectors to recover and for everyone to still be productive, self-reliant members of society. And therefore, any universal social protection program can be time-bound, in the same way that, for example, in 4Ps, the grantees will only be able to access their grants up to 7 years, after which they will be graduating from the program. And therefore, we want a program that should be long enough to allow for recovery, but short enough to ensure that beneficiaries know that they should still be striving to be able to stand on their own and be eventually self-sufficient. I think our social workers should also be doing case management and not just distributing or transferring cash to our beneficiaries, but to manage the cases and meaning our beneficiaries, the households, and monitor how they are moving from one level of well-being to the next one. And this will show us the progress of the beneficiaries in terms of the intended effects of the social protection program. I would also want to see that the universal program, social protection program, should still be complemented by other programs so that other needs of the households are also covered, and that it is not only the lack of income that is responded to, but other more specific concerns that may not be covered by the increase in income. But we also want to make sure that whatever recovery program, social protection program we have is sustainable. So we should make sure that our resources are efficient and not wasteful, that the program should teach the beneficiaries about sustainable production and consumption, and that we do not just want to increase production or increase the sectors in manufacturing or mining or trading. We want sustainable development that not only supports the recovery of our constituents, but also supports the environment so that it continues to be our resource for our life in this generation and beyond this generation. We want the recovery program as a rising up together, so that responsibilities for the programs in general should not be shouldered by the Bangsamoro government alone or by the local governments, but also by active and responsible citizenry, including civil society actors and development partners. I think this is more sustainable when we look at the long-term interventions of the Bangsamoro government. Thank you, Attorney Ishak. Over to you.
Thank you, Attorney Raisa. Let me ask one last question. How do you ensure that the cash transfers that our citizens are receiving benefit the local economy? Because I've noticed that some cash transfers don't actually benefit the local economy in the sense that they get spent outside of the BARMM economy. So how do we ensure that the cash transfer that we are giving circulate within our economy so that it has more beneficial effects?
I think in our case, the cash transfers that programs that we have been implementing, these are targeted towards the poor households, and many of them are actually consume products or services in their own localities so far. But if it's going to be a universal cash transfer, with the majority of the beneficiaries still being those under poverty threshold, I think that will still benefit and the money will revolve around local communities.
Thank you, Attorney Raisa. So that's all. We're finished with the panelists. Thank you for your time, and especially to Attorney Raisa for waiting. You're the last in the panel, and I know the discussions were very long, but thank you for your patience. And now turning it over to Cha.
Thank you so much, Attorney Ishak. That panel discussion was really very, very insightful. And I guess some of the questions that were submitted in the Q&A box were already addressed as well. So right now we will be of BARMM, Dr. Bashari Latif. We are very, very happy that you are still with us, Dr. Latif. Over to you.
Thank you very much, Excellencies, different personality who are with us here today. Strengthening father health services delivery and addressing the COVID-19 pandemic problem is our #1 priority in Ministry of Health in Bangsamoro Autonomous Region, Muslim Mindanao. We cannot do this alone without your support. Thank you for your effort, help, concern, and support. Indeed, the Bangsamoro was devastated by this COVID-19 pandemic. The socio-economic life, each of the Bangsamoro was devastated. Economic loss is enormous. Its impact mental health prevalence among our children, young, and women. All this is a result of poverty to the already poor region. Many are jobless, informal sector suffering. We appreciate your programs and acknowledge your initiative. Your assessments are very timely. It is correct. Recommendation must be realized. But to be honest, the proposal requires finances. It's required budget in order to be implemented. We receive less vaccine allocation among all regions in the country. Those recommendations to have a comprehensive vaccine is much more needed for further amplify and support in doing rollout in the autonomous region. We need more people for our vaccine teams so that it can reach barangays. We need storage facilities for vaccine in every provinces because Cotabato City is quite far from Balsilan, Tawi-Tawi, and Sulu. In Lanao del Sur and Maguindanao provinces, some residents have difficulty in transportations, and those it's hard to reach them. This must be addressed, or they cannot be just ignored. We have problem with internet access, and this is really a big problem to us, especially our healthcare frontliner who cannot give us on-time update. The BRMM, we have just at least less than 10% penetration of internet. This challenge for us, especially our information campaign and real-time reporting of a daily cases. We did plan for the info derived, the vaccine, and to fight plant fake news, gossip, misinformation about this COVID. This is to enlighten the public of the necessity of the inoculation. Darul IPTA, together with our office, will work for the information derived for the fight to fight information, hoping UNDP can help in funding ulama organization to do information derived. We are correct. You are correct that the whole society approach is the key. However, your support, including financial assistance, for all this recommendation is highly appreciated. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Dr. Latif. And now we have also invited the chairperson of the Consortium of Bangsamoro Civil Society, Mr. Gamel Alim, to be our reactor this afternoon. Over to you, Mr. Gamel.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good afternoon, everyone. And thank you for being part of this very important conversation. I accepted the invitation because I know there is no question asked from me. So it will be a nice thing for the rest of the time. The impact assessment is very helpful in many ways, and among others, it can serve as a benchmark for the strategic development program of the BARMM. And I think COVID and the sporadic violence and poverty will still be with us in the next many months. So I would just want to share my thoughts and insights on the issues at hand, and not necessarily as reactions to the reports and recommendations. And in my reflection, I'll be speaking in more general terms because many of what I wanted to share had been discussed, especially the recommendations of the report. The reports and the views of the panel point to the reality that COVID is not only a health issue, but a socioeconomic and even political one. Political in the sense because it requires determined policy from the government. Therefore, the need for a more strategic direction to consider in responding to the crisis. We noticed that the most vulnerable group in the COVID pandemic are the rural poor and the informal sectors, not only in the BARMM, but the whole country as well. The reason is because they lack the necessary coping mechanism to address their basic needs in terms of food and medical needs. Poverty and helplessness are structural problems that makes these economic groups vulnerable. Moreover, although the rate of COVID infection in the BARMM is relatively low, peace and security problems as well as poverty are part of the risk that they face on more regular basis. The assessment reveals that the adverse effects of the COVID disaster exacerbates the problems of human security resulting from unstable peace and security and poverty in the region. To address the intertwined effects of the crisis, both in the short and the long term, there is a need for a more comprehensive strategy by looking into the strategic direction of the conflict, humanitarian, recovery, development nexus to note that economic programs and sustainable development are contingent to peace and stability. Towards this end, there is a need to build a technically equipped and empowered institutional infrastructure that is able to address social protection that can effectively respond to crises like what we have today. The most effective social protection I know program is to improve the living conditions of the poor to ensure sufficient coping mechanisms that can address their basic needs in times of crisis. Doable quick impact projects can be a short-term response without losing sight of a more strategic development goals. Amidst the debate on extension or no extension of the BTA, the strategic recovery plan should be materialized, and the plan should be helpful to whoever runs the BARMM government. And because 80% of the population of the BARMM are rural-based and dependent on agriculture, the recovery plan and robust investment should give primary attention to building a strong community-based economy. This should serve as the benchmark of development for the BARMM. For now, in the interest of survival, it will indeed be difficult to prevent the mobility of people to earn their living, especially in the BARMM where incidence of poverty is high. The only way is to balance mobility and the necessary safeguards by a more stringent imposition of the health protocols. The cash-in-kind assistance are short-term relief support to the victims of COVID. There is, however, a problem of monitoring the use of the cash assistance because government agencies usually do not have enough people on the ground. Cash and in-kind assistance can be maximized to address the immediate needs of the people, but at the same time, providing seed capital for the families to engage in productive businesses. This assistance in cash must lead to some return investment that can eventually propel self-reliance of the families. This requires, however, strict community organizing and monitoring. On the youth accessibility to education, we learned that there are more than 200 barangays in the BARMM without schools. This means children in those areas would have hard time to have access to education. There are also considerable number of dropouts, as mentioned in the report, even in areas where there are schools for several reasons, including unstable peace and security, lack of financial support, and also accessibility to school. Therefore, strong support to families and building schools and working for peace are big possibilities to prevent or reduce children and youth from being out of school or as dropouts. The relevance of the use of social media by the communities in this digital era cannot be undermined. But this poses a big challenge, as the report says, because there is a need to provide the necessary gadgets, especially in the remote and rural areas, as well as in the urban poor communities. There is also a need to train community members on the use of internet and other forms of social media. But this will be very helpful both in dissemination information about COVID and its use for the children's education and others. Government therefore shall seriously consider the use of internet and empowering the adult communities in its use. The social media plays a vital role in promoting the use of vaccines to prevent infection. But at the same time, there should be a counter-narrative to reports of isolated adverse effects of vaccines popularized by some health experts to deter the common perception of the downside effects of the vaccine. And I have the feeling that the religious groups can help in this information drive. In all these endeavors, the BARMM government shall encourage the participation of as many stakeholders as possible to include the vital role of the INGOs, the private sectors, and the local NGOs. The INGOs can both provide technical and financial support, and the local NGOs can boost the human resources in the field. With the help of modern technology, programs towards recovery and development may usher in good results. And finally, it is imperative that as we plan for de-escalating the impact of the COVID pandemic and recovery towards development, there is also the need to reflect on the fundamental contradictions in the Bangsamoro. Who controls the economy and how the economic resources and opportunities are distributed among the population. Development is not simply measured by increased GDP, but on how the dividend of the economic growth is socialized. The BARMM is a highly franchised territory dominated and controlled by political clans who enjoy political and economic privileges, while majority of the population is poor with no coping mechanism to cushion the impact of crisis like what we have today. Robust investment and development programs must benefit the greater majority and shall not only benefit the oligarchs. Social economic development is highly contingent on how wealth and political leadership are equitably shared. Thank you very much.
Thank you so much, Sir Gamel. And again, thank you to everyone who have stayed with us after 3 p.m. I know we're already quite over time, but we're still grateful that you're still with us. We had over 200 participants for this webinar. Before we close this activity, I'd like to ask our panelists and our speakers who are still present and with us, if there's anyone who would like to say a closing message or a few words, perhaps before we close this activity.
No, it's over from the chat.
We are fine. Chief Minister.
All right, I think everyone has already said what they wanted to say. At this point, we would like to inform everyone that we will be sending out a newsletter to everyone who have registered for this activity. We will be sending both the presentation of Ms. Yemi and the digital copy of the report to all those who registered via the Zoom registration link. Again, thank you so much, everyone, for being with us this afternoon. And we hope that you have a good day. And all of our stakeholders for the launch of the Socioeconomic Impact Assessment of COVID-19 and BARMM. Have a good afternoon.
Thank you.
Thank you. Thank you very much.
Thank you very much.
Okay. Let me just express on behalf of the BARMM our gratitude to all the speakers. First to the UNICEF, UNDP for the launch of this assessment. Secondly, for the speakers, for the panelists, the reactors. It has given us a very comprehensive insight of what should be done in the future. So we are very thankful, and we wish that the organizers and the various line agencies and partners will continue to help us in addressing the challenges we are facing now, especially on the related to the COVID-19. So again, thank you very much on behalf of the BARMM government.
Thank you, Chief Minister. Thank you for staying with us until the end of the event. That shows your commitment on such an important issue. Cha, can we take one picture before we all leave?
Okay, same.
Sure, Selva. So I think our host laptop is with one of our colleagues, but I will be asking perhaps PJ or D to please. Oh, we will count. Okay, so we would like to ask all of the panelists to please switch on your camera so that we can take a photo, please.
Okay, Latif, I think your camera is off. It's a blank.
Dr. Latif?
Kanina, di niya na-on, no?
Baka mahina yung internet niya.
Oo,
Wala na.
ano, binibay para kang
Okay, so...
putol-putol ba?
Okay.
Okay, please turn on your camera.
Okay, Dee, ready when you are.
Hold on.
Okay.
Okay, well, sorry. Okay, 1, 2, 3, smile. Okay, thank you.
Everyone.
Okay. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you, everyone.
Thank you, sir. Thank you very much.
Imagine if I was doing the